And we are going to start with Elissa Baker, who is managing partner at Phase 2 Health. And Elissa, are you here?
Yeah, right here.
Cool. Elissa is going to tell us about identifying product market fit and defining realistic revenue strategy. Thank you, Elissa. The floor is yours.
Okay, first of all, I just want to say I'm really happy to be here. FemTech is an emerging space. It's been emerging for a while, but it's really starting to gain the traction that I've been hoping to see for a long time. I've been in healthcare for over 10 years, starting out as a nurse, and I've been in the tech side since roughly about 2011. It started here in the US where I'm based and where I do most of my work with a big EHR boom, with everyone's records going from paper to electronic, and then just watching whatever's been able to build off of that since then has been really exciting. Most of it has been outside of the women's health sector, and most of it has been focused on companies that really are led by men. So I know that's been a big topic of discussion today, and just being in this industry for as long as I have been, I haven't seen as many female founders as I would like to see. And I really do just think that men are better at selling mediocrity than we are. Here in the US, if you went to Harvard, if you have a certain pedigree and a certain network, that seems to be enough to get you by for funding. But we as women really have to step up and prove ourselves and prove our worth and really prove that we're going to be able to make a difference with our tech. As it relates to FemTech in general, I have found that when I do talk to male VCs, that they really don't know a lot about what's going on with the female body and how this fits into the market and how it helps. So product market fit is a big deal. You really have to show, how you make an impact financially, because it's more than a black and white thought. So I'm going to dive into that today and then talk a little bit about structuring your business model. So again, started out as a nurse, have worked for multiple startups here in the US, building out marketing and sales foundations. I'm a managing partner at Phase 2, where I focus on the marketing and growth side of things. I'm an advisor for FemTech Lab, which is based in London. And then I'm co-founder and president of Mama, which is a postpartum depression and postpartum anxiety solution here in the US. I'll talk mainly about the United States healthcare system because that's what I know best. It is a bit different from maybe many of your own healthcare systems and where you may fit in the market there, but hopefully you'll be able to take from this presentation as well. And hopefully if any of you are thinking of expanding over here, you'll find it to be helpful. When you enter the US healthcare market, you will discover almost consistently that there is a low willingness to pay from consumers with any direct-to-consumer product that doesn't really change something that you can't see in the mirror. So we're a very superficial society. You can generally get somebody to jump on board with weight loss, anything related to aging, beauty, but it's a lot tougher to get into those deeper pieces of healthcare that impact our bodies coming from the consumer. Hospitals and providers are generally a decent window to go into to get to that patient and to build trust and to get them to use a product or a solution, but there's a low willingness from them to pay. It isn't that they're necessarily trying to be difficult, they are themselves also struggling to gain reimbursement from our kind of complicated healthcare system. And so that's what you're really going to have to prove out to them. Same with insurers, they want proof that your solution works, and that takes a long time to give them, and they have a very long sales cycle. On the employer side, it is a little bit more exciting to be on that side of the market, but it's becoming very saturated. Employers generally want to be able to offer their employees really great perks and benefits that show that they are seen and can keep them happy and keep them employed by their company. But it is highly competitive. And if you have a solution where there are many other solutions at the market, it's very tough to get a seat at the table. There are also expensive barriers related to tech and privacy, and you need to achieve things called high trust, which can be very expensive and time consuming. And ultimately, investors always need to know how your solution is being paid for. They need to see a scalable business model. We often at Phase 2 and throughout all of healthcare, we like to talk about what is called the chasm. So when you start out as a product, you're generally going to have early techies. They're the early innovators. They're really interested and excited about what you're doing. They're willing to jump on board. The sale feels easy. It's a really exciting time. Then you have those early adopters that are generally visionaries as well. Not quite as easy to convert as the techies, but they jump on as well. Moving from that stage over into the majority of those who will jump on board to getting your product can be very difficult, and you can often fall into the chasm. And that is where you need to really lean on your techies and your visionaries, those early adopters and innovators, to understand if you have proper product market fit, and how your solution is working for them, how it has tweaked, how you had to tweak it to meet their initiatives, and what the ROI is for them. You're going to be able to use those stories and those metrics to convert the early majority. So we'll talk a bit about product market fit. I'm going to go through each one of these bullets and tell you just a little bit of a story for each one, because I do think that's the best way to kind of use examples. Product market fit is going to be very different upon every single product that's out there. You might fall into similar buckets, but I really like to have individual discussions with people about achieving product market fit for their particular solution, because you're just going to offer a different perspective on the market and a different way to approach some of the issues. So I will share this deck with the FemTech analytics team, and anybody who wants to reach out with questions, please do. Oftentimes you find out that you have the wrong product. It doesn't necessarily mean that the solution that you want to solve isn't solvable with your product. It just means that you aren't solving a big enough pain point. So you're not showing maybe a provider or a health system or even a consumer a large enough ROI. Your market size or your TAM is too small. And I've included in here a link to a really wonderful article that helps you determine your TAM and how to reach your market. And the market may be oversaturated. So we'll tell you a story about oversaturation. We had a startup that we worked with not long ago that was selling into the employer market. They were a digital musculoskeletal solution, and they were great at they were great at reducing opioid usage. It's just perfect, right? Usually in that digital musculoskeletal market, you have users that skew a bit older. So tech can't be overcomplicated. There were several large competitors, billion-dollar companies in the space with them, whose tech was great and exciting on paper. You went to their website, it was really beautiful. You got really excited about it. They were able to build up a lot of hype because they had a lot of money that they were able to get investors on board to give them. This one was a little bit smaller solution. They'd been around the longest. They had really figured out how to get their users to consistently use them, and their opioid rates were the lowest of all, amongst other things like overall medical spend and things like that. But they were small, and they weren't able to get traction very quickly, and they weren't able to get their story out there very quickly. The market was becoming extremely oversaturated, and despite their product probably being the best on the market, the bigger names won out. It was a sad situation. The founder was female, the bigger names were male, and so that was a tough piece to watch happen. So you need to always determine if you're in the right market. You might have the right product, but the market may be so oversaturated that you need to shift things up a bit. We had discussions with them about trying to move into a different market where they maybe would have been helping kidney patients so that they can move their bodies more, because that's a common issue with dialysis, but they didn't want to wrap their head around being outside of the market that they were currently in, which was just impossible to scale in at that point. It could be that you have the wrong message. You might have tremendous value and you're just not communicating it accurately. One of the most common things we coach our startups on with their marketing is when we arrive to your website, we almost immediately need to know what you offer, especially if you are selling in the direct-to-consumer space. When I come, I need to know what I'm looking at. I need to know what I'm about to pay for. Flowery language can only get you so far. And then if you're selling into the provider or the health system space, you really need to be able to articulate exactly how you're solving their pain point and either reducing their revenue, increasing their revenue, increasing any reimbursement that they may be receiving from here in the US, things like Medicaid, Blue Cross Blue Shield, United Healthcare are insurers, or how you are lowering their costs. Maybe you fit in a way that reduces their workflows or reduces certain staff that they need or helps free up time for staff to do other activities. So you have to really kind of fit into that pain point and show where you make an impact. Or you might have the wrong audience. The story I have here is I recently learned of a really awesome solution that can detect breast cancer early by, and bear with me as I tell you about this, by pumping the breast, a little bit of fluid comes out, and then they're able to test that and detect breast cancer. And let's think about that in two different markets. Let's think about it in a direct-to-consumer market as your audience. Me hearing that just as a woman, as soon as I heard like, oh my gosh, I have to pump my breast at home and test it at home. My provider isn't around. They're not going to be able to walk me through it if I did it wrong. They're not going to be able to explain my results to me. That kind of freaks me out. And I'm not really overly interested in that. I'd rather like have my blood drawn by my provider or something. So I'm immediately kind of lost as the consumer. But if they were to take that solution over to the provider, selling into the right market where they're able to achieve benefits from what we would call downstream revenue, that would be the most beneficial market for them to sell into. And so what that looks like is the provider uses the apparatus or the tool, they walk their patient through what to do, the patient goes through the entire process, the pumping, they test, they find out they're at risk, then the provider is able to send them to their imaging center for an MRI, mammography, and run any genetic testing. There is downstream revenue in all of those services that are a benefit to the provider. So we have now built a case for that particular solution. I made a note on here that it's really important to remember that product market fit when it comes to healthcare and health tech is more than just missing need for consumers. Consumers are very tough to engage with. It's very tough to engage consumers with their own health, as I've said. So you have to find a way into the market through multiple channels, and it takes time. Once you enter into the market, you have to work to build trust. Trust can come in 4 different buckets. You can build trust by network, and that you are a known person in the healthcare field. You have professional accomplishments that may precede you. You may have started other startups. You may have worked as a doctor. You may have been, successful in research. You bring a little bit to the table, and you also bring relationships to the table. Selling into healthcare is very relationship-based. Trust by association, you want to bring on the right investors, the right advisors, and the right early customers to help you build that trust by association. With investors, they need to have a network that they can introduce you to, and they need to completely understand your product, you, and what you're bringing to the table, and understand the problem that you're solving so they can speak about you. Same with advisors. They need to advise you along the way, but also be able to tap into their own network and talk about you as well. And with your customers, you need to be able to bring them on, and they need to be willing to share the story about you help them achieve certain initiatives. Trust by evidence would be any peer-reviewed publications you can do. A lot of investors like to see research. They like to see that you've proved it out. Same with any early adopters and even those laggards at the very end of that chasm that I showed you, or the curve I showed you. They really like to see proof. Industry article mentions are great. There's a lot of great healthcare publications here in the United States, I'm sure throughout Europe as well. And then if you're going in the direct-to-consumer market, it can become very fun because you can work with lots of different publications that are out there. When I share this with you, you'll be able to read this case study that we did with a company called Viber here in the United States. They're a patient financial application platform that helps cancer patients afford their high-cost medications. We did a case study with a major health system here in the United States called Advocate Aurora Health, where you'll be able to read about how Viber helped the initiatives of the hospital. So the case study is less focused on what the solution is and how great it is, and more focused on the initiatives of the hospital and how Viber was able to fit into that goal. And that's going to be really key. You have to understand what your customer needs to achieve and how you can help them achieve it. That is more important than talking up your solution and how great it is. That kind of comes later after you've met with them and understand where you need to take them. I shared this slide with you as well because it is kind of in that trust field. We came up with a great message for Viber, that they're your trusted financial assistant platform. That really resonated and worked well for them. We showed a lot of their different stats and what they were able to achieve over time, and then shared a lot of the different major health systems that they were working with. When they present the slide to potential customers, it really resonates with them and really helps build up that relationship. I'll talk to you a little bit about business model. Make sure I'm not running out of time here. So when you're working with investors and you're trying to get traction on your investments, you're going to need to be able to show growth and ROI. You're going to need to understand who's going to pay for your solution and how. In order to do that, you need to look at the major problem that you're solving and the cost of that problem annually to the organization that you're talking to, or perhaps just in general. So I'm going to share with you here a sample business model. You can go in and look at it. I'll pull it up quickly for you so you can see it. This was built out for a company that we got funding for. They're very early stage and growing now, but you can see this is how they were able to ask for their pre-seed round. And it has every single thing that they thought they would spend money on, kind of how they would grow over time with customer success, data scientists, their creative team, and then most importantly, what a cash out date would be, where they would potentially run out of money, and then show how much cash on hand, how they were making money, and it looks at it over a course of a year. I'm not going to dive too much into it and talk about it. You can look at it, and if you have questions, please feel free to reach out to me. I'll give you one example though. With Mama, the postpartum depression app that I'm working on currently, this is a $14 billion annual problem in the US. It impacts over 600,000 women, with more cases going undiagnosed that are, and we anticipate that caseload to go up every single year as it's becoming more and more common to talk about it. $30,000 is the average cost per untreated patient with postpartum depression in the US. And our solution, we have determined, would save a provider or an employer about $3,600 with the service that we provide. Knowing that, we typically look to see a 10x ROI. So we take 10% of the savings that we are able to show them, and then they receive the 10x ROI. TAM for investors, we anticipate grabbing about 15% of the market, which would be about 150,000 women, bringing in 360 per year, equating to roughly 54 million in revenue. That's the dream goal, and that's what we're working towards. So it gives you something to work back from, and it gives you something to have that initial conversations with investors and talk about how it's being afforded. This is the employer model. It's a little bit different when we look at it from a provider's perspective. From there, where our solution would help bring in $3.5 million in annual reimbursement revenue through increasing their HEDIS measures, which is a Medicaid measure here in the US, and helping them negotiate higher contracts with payers here in the US. From that, we would take 10%. And so our contract with that specific organization would be $350,000. In addition to a good business model, you need to be able to prove ROI to your customer. And the reason why that is such a strong benefit is you learn more about their business and their direction, their initiative, and where you fit in, similar to that Fiverr case study that you'll all be able to take a look at. It will help you provide focus on product development. Sometimes you're going to need to pivot your solution to help increase the ROI, and then you'll be able to take that and have that. It's almost a domino effect. You do it for one, you know what works. You're going to be able to do it consistently across the board for other systems and other organizations and partners of yours. Helps you provide focus for implementation and support. You'll be able to show a growth strategy and scalable business model to investors. You'll continuously validate your value, and it will help with the stickiness of your partnership. If you can show year over year that you're really increasing ROI for the particular organization that you have a contract with, they're going to consistently partner with you. If tracked appropriately, it can create a continuous marketing stream for you with content, case studies. Oftentimes your customers will be so happy they'll sit on a panel for you, you'll go to conferences with them, and you continue to work through that.
Elissa, I'm sorry, we have to move on. This is solid gold. I mean, I'm so happy we're going to have the slides after. I think this is so helpful. I want to thank you very, very much for this, and I'm sure the audience as well. I look forward to asking you a bunch of more questions at the panel. But unfortunately for everyone, but also fortunately for everyone, we have to move on to
questions. Please send me a message after today. I'm happy to help.
Thank you so much. Thank you so much.